Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another of our Bryan Health Radio podcast interviews with Melanie Cole.
Everyone occasionally feels blue or sad, but these feelings are usually short-lived and pass within a couple of days. But when you have depression, it can interfere with daily life and cause pain for both you and those who care about you. It's a common but very serious illness. My guest today is Dr. Dave Miers. He's the Counseling and Program Development Manager for Mental Health Services at Bryan Medical Center. In addition, he co-chairs the Nebraska State Suicide Prevention Coalition. Welcome to the show, Dr. Miers. Tell us about how to identify somebody in yourself or in someone that you love that's going through real serious clinical depression versus just feeling the blues sometimes.
Well, it's important to note that depression is one of the most common mental illnesses. About 10% of the population at a given time is known to be suffering from some type of depression. So it is important to know the signs and symptoms. You know, there's hope, there's healing. You know these signs and symptoms and can get folks connected to resources. That's very important. Everybody feels, have a down day, feels the blues once in a while, but typically you start feeling better within a couple of days. When we're talking about depression, these symptoms interfere with your daily life and routine for a period of 2 weeks or more, then we're generally talking about some type of depression. So those symptoms to look for in yourself or into others would be a change in your mood. A lot of times individuals with depression feel sometimes irritable, have trouble sleeping. Either you're sleeping too much or you're having trouble falling asleep. You see a change in appetite, and that can go both ways as well. You're eating too much, eating all the time, or you just have no interest in eating. So then you see either weight gain or weight loss. Lack of energy, feelings of worthlessness, self-hate, and guilt. Sometimes having trouble concentrating. Another sign and symptom to look for is if you lose interest in activities. Let's say you like to play basketball or you like to play a musical instrument. All of a sudden you just find yourself not wanting to do those things and being more isolative. That's generally a sign of depression. Feeling hopeless or helpless. The repeated thoughts of death or suicide. I mean, if you're having thoughts of suicide, then that's a symptom that we need to take action with right away. And then just lack of pleasure and just any other activities that you really like to do. Again, if it's a period of 2 weeks or more, then we really need to get somebody connected to help.
Dr. Miers, recently in the news, there's information about screening even our teenagers for signs of depression. And do you think we should be screening teenagers and looking at people more closely, or wait till they come to you?
It is important that we do screen individuals. There are screenings available on our website, at the Bryan Medical Center website. We do have screenings available for depression. There's actually a screening there. If you're a parent concerned about your teenager, you can go on and answer questions based on your concern about your teen, and it tells you whether or not the signs and symptoms are there. It's not a diagnostic tool, but it is a good way to, confidential way to go in and determine, is depression possibly present, and then it gives you steps on what steps to take. So I think that's a good practice universally. I think if sites or physicians, clinics, different places have the protocol in place, that if we screen somebody and it does screen positive, then to have those resources to connect them to, then yes, it's important to have that screening in place. We have counselors and programs in place to help individuals with depression. So having that screening in place and then getting an individual connected if needed is very, very important.
So let's speak about treatments a little, Dr. Miers. We hear about, even on the news and advertisements all over the place, for Prozac and things that to help you and mood elevants. And so speak about the treatments and what's going on in the world of treatments for depression.
Well, with treatment with depression, it's really individualized, as with treatments of other mental illnesses. But research shows that depression is one of the most treatable of the mental illnesses, and what research also shows is that if you take look at it in a couple different treatment approaches, in that being talk therapy can be very effective. sometimes the individuals can see a therapist and go for counseling, and that is the only treatment that is needed, and they find relief from their symptoms relatively quickly from talk therapy. Some individuals work with their medical provider, their physician or psychiatrist, and receive medication treatment for depression, and that alone sometimes can be very effective for individuals. But research shows that combining those things together, medication and talk therapy together, sometimes leads to quicker results or quicker symptom relief. So those are some things that individuals can do. I mean, there's different support groups. There's some different things that individuals can do on their own as well. In terms of, in addition to getting treatment, such as counseling and medication, if individuals are monitoring their sleep and getting adequate sleep and exercise and nutrition, combining all those things together can be very effective.
And what are the medications intended to do?
There's different theories in terms of treatments for depression. One of the theories is that there's a chemical imbalance in an individual's brain, that chemical imbalance in the neurotransmitters, and the medication helps rebalance that or put that into the correct balance and helps an individual feel better from their symptoms.
Okay, so if somebody has depression, you've diagnosed them, maybe put them on medications, is this a lifelong thing? Is this something that does not go away, or is it something that can be helped and possibly even cured?
Again, it's a very individualized thing, but a lot of individuals who experience depression and receive treatment, have a very positive outcome in that. As I mentioned earlier, it's very treatable. They see symptom relief, and oftentimes individuals then do not see a reoccurrence of that depression. There are some cases where individuals may receive treatment and receive symptom relief, but then see a reoccurrence of that depression later on in life. So it really is an individualized approach to looking at depression and how that affects individuals. But in a lot of cases, it's you're treated, you see symptom relief, and sometimes individuals may be diagnosed and then receive medication and therapy, and then sometimes might need medication for longer term based on someone else. So again, it's very individualized. There are some types of depression, in terms of some cases with depression where medication and talk therapy are not effective, then there is what we can call electroconvulsive therapy, ECT treatment, that a psychiatrist administers, that is oftentimes then prescribed as a treatment approach for treatment-resistant depression.
Dr. Miers, do you feel there's still a stigma? There's been stigma around mental illness for years, and depression being one of them. Do you feel that that's still there, or are we talking about this more, and it seems to be a more accepted thing that people are now more willing to get help for?
There is still some stigma surrounding mental health, but it has improved greatly over the years, and there is a lot of positive steps in terms of that movement to lessen the stigma. Depression is something that can happen to anybody. We see more depression. It's actually higher with individuals who are seeking treatment or have a diagnosis, medical diagnosis such as cancer, diabetes, or heart disease. So we're seeing that depression, treating depression can help individuals with greater health outcomes with their dealing with other health issues as well. So we're seeing more and more people, realizing that and identifying that depression is real, it is treatable. There is help, and there is hope for depression, and making sure that individuals are aware of those resources. So yeah, we're definitely seeing improvement in that area.
And in just the last minute, tell listeners why they should come to the counseling program at Bryan Medical Center.
Well, we have a very passionate group of staff who are very dedicated to working with individuals with mental health issues, and care greatly about our community and helping individuals find strength and find the path to feeling better. And so by going to our online screening, oftentimes that's the first step in identifying if the signs and symptoms are there, And if so, then they can contact the Bryan Counseling Center and be connected to a therapist for an outpatient appointment. If it's an emergency, if it's considered a mental health emergency, we also have a mental health emergency department available 24 hours a day, 7 days a week here at the Bryan West Emergency Room. It's one of the few of its kind in the United States, and we have staff available 24 hours a day to help individuals in a mental health crisis.
Thank you so much, Doctor, for being with us. I applaud all the great work that you're doing. You're listening to Bryan Health Radio, and for more information, you can go to bryanhealth.org. That's bryanhealth.org. This is Melanie Cole. Thanks so much for listening.